Welcome to PD Connect, connecting the Parkinson's community with resources, information, and each other. Today, we're pleased to have Hannah Grassie with us. Hannah is a speech pathologist who has been clinically treating patients with Parkinson's since 2012. She is LSVT Loud certified. She's also very actively involved in the Parkinson's community. She's led local support groups. She takes part in Team Fox events to benefit the Michael J. Fox Foundation. She also currently volunteers with the Parkinson Foundation of the National Capital Area in the Washington, D.C. metro area. She is also the founder and creator of a blog called The Parkinson'S Report. Welcome, Hannah.
Thank you.
Thanks for joining us, Hannah. Let me start off with, can you explain a little bit about what a speech-language pathologist does?
Yes, and let me first apologize for the mouthful. Speech-language pathologist is a little tricky of a title. So speech-language pathologists are trained across the board in all things related to really any type of communication, science, and disorder. But especially in relationship to Parkinson's, I'm maybe going to highlight a little bit more of what we do. So speech-language pathologists working with people with Parkinson's really are addressing everything, including cognition. So I'm going to call that sort of the thinking processes, and that includes memory. They also can cover voice, so vocal quality, vocal volume. We then also address speech, which is the articulation portion of it. How well are people able to understand what you're actually saying? And also swallowing. So I usually give the example that speech-language pathologists really work from the top of your head to the top of your throat. We kind of get that whole part of the body. So we cover quite a spectrum of diseases, disorders, and just various deficits that come along with life.
In terms of the areas or the symptoms that you work with as a speech-language pathologist, in your experience, when does someone with Parkinson's start to encounter the symptoms that they may have need of that kind of treatment?
Yes, Tanya and I actually discussed this a little bit, and one of the things that I really, would like to point out about that, thinking about a timeline, and you all, I'm sure, are familiar with this, but there's just simply no one that experiences the exact same set of symptoms. And so I think it's important to point out that everyone's timeline is also going to be different. So for instance, just recently, actually, I was working with somebody in their mid-40s who was having a lot of difficulty with swallowing. And I've also seen some folks who maybe they start out and they're having difficulty with their voice and they never even have any changes in their memory, whereas others will. So, I think that the important thing about timeline is knowing that just because these symptoms can be treated doesn't mean that you necessarily will need the treatment for each of those areas, but also that knowing a little bit more about them can help you identify if they're actually occurring. Sometimes there may be a change that you're not fully aware of because you don't recognize that, don't know enough about it, about that particular symptom to know that it might be tied to your Parkinson's. So timeline is incredibly unique to each individual, and I would definitely say awareness is a really huge piece of knowing if and when that's occurring for you.
That's very interesting, Hannah. I think I mentioned to you the other day that I really associated swallowing issues with the older population with Parkinson's, not someone who is a young onset person with Parkinson's. And I mentioned to you that I didn't know that I was having difficulty swallowing until I was able to actually swallow again. But I was having difficulty getting my pills down, but I didn't think anything of it because I didn't even associate swallowing with the Parkinson's.
Yeah, no, you're absolutely right. And especially swallowing, when I talk to people about swallowing, whenever I'm evaluating them, I think probably almost everybody's default is, oh, I swallow fine. I've been swallowing my whole life,
Right.
swallowing, the actual process of it is incredibly complex. And so if you have something like a movement disorder like Parkinson's, if those muscles are not moving the way that they need to, or at the time that they need to, or to the degree that they need to, it can throw things off, and pretty quickly. So, going back to that, awareness is a really huge piece, I think.
It's interesting. You talk about the fact that the timeline is different for each person, and that's a constant theme with Parkinson's. That everyone's journey is different. I mean, I don't remember who it was that called it the snowflake disease, but that everyone's Parkinson's is truly different, and their journey with it is different, and their symptoms are different, and like you said, the timeline at which they might experience symptoms is different. Bearing that in mind, have you observed issues with people through their medical professionals, or through, let's say, the movement disorder specialist, not necessarily identifying some of these other symptoms that can be treated by a speech language pathologist?
Oh, that's a good one. So first I have to say, I have had the opportunity in the past year to year and a half, to work alongside some really amazing neurologists here in the Washington, D.C. area. A lot of the movement disorder specialists that I have worked with are incredibly attentive to the full gamut, but that's what makes them specialists, right? And so the first piece I would say there is, that's one of the very first questions I always ask during an assessment with someone with Parkinson's. I ask them, who is your neurologist, and are they a movement disorder specialist? Because I've actually found that a lot of folks don't realize that they need to be with a movement disorder specialist. So that is, I think, a very significant piece. So once you're with a movement disorder specialist, I feel the tendency is for those neurologists to have maybe a larger view of what all needs to be addressed. With that said, there's also some great neurologists that I've worked with that aren't specialists that have been receptive. For instance, when I've worked in skilled nursing facilities and the physicians actually come out to see the patients, I've had several that are open to working with me and are open to me coming to them and saying, hey, it looks like this patient is progressing through Parkinson's, and this stage of where they are in the disease looks like swallowing, or it looks like voice or cognition, is going to be an area that needs to be addressed. And not all physicians are open to that type of collaboration, but I've been fortunate that, the ones that I've worked with have been. But certainly collaborative care among your medical team is paramount. I mean, it's you can really get no better care than when your medical team is communicating. So, whatever, as the patient, as the caregivers, whatever you can do to ensure that that's happening, and that not your role, the team should be doing that, but, just making sure that they are able to communicate to one another is important.
Well, but your role is, when you say not your role in terms of the team communicating with each other, you talked about awareness, and obviously from the patient perspective and the care partner perspective, their role in order to be treated, and for their the medical professionals to realize what their needs are, what their symptoms are that need to be addressed, they have to be communicating about that, which starts with where you started all of this, which is you first have to be aware that you're experiencing these symptoms, that your voice is changing, that you're having swallowing problems. There is something different with your speech. How do people who live in Parkinson's or their care partners, how would they become aware of those, or what information is out there to help them become more aware if they're experiencing these symptoms, or whether they might be or not?
Yeah, well, so I would start, so the website, my blog and website, the Parkinson'S report, and one of the tools that I'm trying to ensure that I'm putting out there is that there are excellent resources available. Sometimes digging for them is, I think, why people don't take the time to find them. And so one of my objectives really through the website is to make things more easily navigable and make it a little bit more accessible. So, okay, you're looking for, hey, what are the symptoms I should be discussing with my physician or my medical team, here's a, a short list of what you can look at. I think that the Parkinson's Disease Foundation has a few of those symptoms listed that are helpful to just sort of make yourself aware of before you're talking with your physician. The Davis Finney Foundation, their website is very thorough and has really excellent resources, including documents I think you can actually print off that you can take to the physician with you. And it's sort of a checklist and also kind of key questions to discuss. But remembering too that when you get to the physician, so yes, awareness is important, but when you get to the physician, I would say don't leave anything out. Do not leave anything out, because even if it's not related to your Parkinson's, it could help connect some lines. Even if it's, a change in your sleep pattern or, increased phlegm or, any tiny little change, I would say is important to mention, because that's what makes your neurologist and your medical team skilled services. It's that we've been trained to listen and to identify if and how those symptoms might be tied together.
That's a great idea with the checklist. I know that I went to see my movement disorder specialist once by myself, and that was it. One time. I wasn't allowed to go by myself again anymore. Because when Chad goes with me, the doctor will ask questions, and sometimes I'll say, "Oh no, I'm fine," and Chad's looking at the doctor like, "She's not. We need to talk about this." So that one time I went by myself, I left and I called him and he said, "Well, what about this? What about that?" And I said, "I don't know. I didn't ask."
Oh yeah. Yes. Well, that is, I think, really important. It doesn't even matter if you have Parkinson's in this case. I think preparing for your appointments, especially, like, I always take something to jot a note down. I have a planner I always keep with me. Of course, usually I have my phone on me. And I make a list before I get there, because sometimes, like you, Tanya, I get in the middle of it and I think, well, has anything changed? I don't think it has. And then, you skip over it and leave, wishing you had the information. And the same thing goes for when information is provided. You don't have to have Parkinson's, you don't have to have a cognitive deficit to memory trouble, to miss something or to forget it later on because your mind is busy. So jotting those notes down is an easy tool, before you get there and while you're there, to make note. So when you come back and Chad says, "So, what happened?" you can say, "Well, let me consult my notes."
The only bad part about that is I can't read my own handwriting because of the Parkinson's. It's impacted my handwriting. So that would be a problem for me.
What about, I'm so curious though, have you ever used the speech to text?
No.
Like on your phone?
Oh, yes, I do. I do use that, and that works well.
Oh, good. Okay.
One thing that actually, as we've been going through this discussion, I was thinking about one of my first experiences before I was diagnosed with Parkinson's is that I felt like I had the words in my mind, but they were like not coming out of my mouth. I felt like I was fumbling for my words.
Yes.
And to me, I felt the delay. And that was one of the early things for me. That was even before I was diagnosed.
Yeah. Well, so I usually put, also I would call that, like language, right? So, and I usually put language under the umbrella of cognition when I'm thinking about Parkinson's. And that can be such a frustrating experience. You know what you want to say. It makes sense in your mind. Somehow it's just delayed in getting to your mouth. And this is, one of the things actually that can be addressed if it inhibits you from your day-to-day activity and communication, which it can, is, a strategy. Certainly are strategies that speech language pathologists can go over and really help you practice, because you can't always plan what you're going to be saying.
Right.
But you can think about, identify 2 or 3 times in your day or maybe in your week where you think, okay, this is a time where I'd like to get it right. And so I'm going to, again, do a little bit of planning of, what are my thoughts before I get there. So that's certainly not uncommon, Tanya. I've worked with a lot of folks, who really struggle with that.
Well, since we're talking about cognitive function, can you talk a little bit about what types of skills are addressed specifically in cognitive therapy? Because as I understand it, that's one of the things you do as a speech language pathologist, right?
Yes, Chad. Yeah, so cognitive therapy is, just like any other type of therapy a speech language pathologist would do. It's just a little easier to call it cognitive therapy. So, when you walk in to see someone and they say, well, you're a speech language pathologist, why are you working on my cognition? So we often
Right.
just call it cognitive therapy. I think one of the most obvious areas maybe that people think of when they think of brain skills is memory. And memory is a big component, but the brain does so many amazing things for us. And some of the, we call them executive functions of the brain. So the executive functions do all of the work, when it comes to our thinking skills. And some of the executive functions that are known to shift a little bit, that can change when you have Parkinson's, are areas like planning. So, being able to sort out not just which steps are involved in order to complete a task, but even sometimes the sequence of them. So, for instance, you're trying to get together with friends, and you're having to take a little bit extra time and maybe implement a few strategies to be able to delineate, okay, who am I going to invite? And then reaching out to those people, what avenue am I going to reach out to them, email or text message or phone call, and then creating the actual event, that becomes a lot more stressful. It also becomes a little bit harder to do without strategy. So that's planning. There's also sort of that, the skill of initiation of a task, I'll call it, but that could be anything. A task could be any type of any part of your daily routine. Transitioning from one thing to the next, or getting out of the bed to get dressed. Sometimes that skill of being able to initiate becomes difficult. We definitely see that in movement, right? In Parkinson's.
Right.
So having trouble initiating movement. Problem solving is also part of cognitive therapy. Also something we call cognitive organization, which is just like, organizing your mind, organizing your thoughts. Tanya, that kind of links back a little bit to the language thing we were discussing just now. So organizing your words, there's a lot of different things that your brain does for you that when it's not moving fluidly the way it used to, you begin to see some changes, a little bit more. It might be a delay. It could be just a little bit more struggle to get those things done. So cognitive therapy really is focused on, whichever area, I just mentioned a few there, but whichever area really that you've found has been difficult for you, and that will be found in the assessment, and then you'll, address that in cognitive therapy.
Tanya, do you want to talk for a minute about some of the cognitive symptoms that you've experienced?
Sure. Once again, like I'm having these aha moments as we're talking to you. When you were just explaining the executive function and what it involves, including planning, sequencing, problem solving, organizing your thoughts, I looked at my husband or looked at Chad and I said, that's me. I pointed to myself because I feel like I have ADD or something. Because but I never really associated that with the Parkinson's either. I just thought maybe it was just because I was getting older or something.
Sure.
But it really is a challenge if there are multiple things that are going on at the same time, trying to prioritize which to do first.
Yes.
I have actually looked at Chad before and said, I don't know where to start.
Mm-hmm.
And so he's like, okay. So and he's very good about developing a plan of attack.
Mm-hmm.
So, and that gets me on the right track.
Yes, that's a good example. And I want to point this out, Tanya. You mentioned, is this Parkinson's or is this age? And I think that that's where having a community can be helpful, having a community of people who have Parkinson's, because you can, although symptoms are different, you can kind of compare notes and also discuss that type of thing with either if you're seeing a therapist, a speech language pathologist or someone like that, or a physician, and saying, do you think this is age or do you think this is Parkinson's? Because other people also experience those types of things outside of Parkinson's. So it's good to be able to track your symptoms and to identify, delineate which is this. But it sounds like the two of you are a good team when it comes to when you have that breakdown and you say, okay, this isn't quite working, how do I move forward?
I think we work well as a team in terms of dealing with it in the instances where it occurs. But, truthfully, I don't think we've done a great job of identifying that that's a possible symptom of Parkinson's.
Sure.
As we've been on this journey, and the more I learn about the Parkinson's community as a whole, including through like this podcast and the other things that we do, it's the non-motor symptoms that so often are misunderstood. There's a lack of awareness. They're not addressed oftentimes because the person experiencing them doesn't even know they're experiencing them. Like Tanya talking about her situation with where, is what I'm experiencing attributable to age, or is it Parkinson's?
Mm-hmm.
And it's noticeable with Tanya because Tanya is a type A personality, extremely high intelligence, and was very organized, in all the times that I've known her, and so it jumps out at her when it happens, and it's noticeable for me as her husband.
Right.
But I will tell you candidly, until this podcast, and until you and I are sitting here talking right now, I did not know there was specific therapies available for that. I mean, that is that's the amazing thing about this podcast is as we do this, we're learning with every episode, along with hopefully our listeners. But I think it's also important for us to be candid, and I can tell you candidly, I did not know that was something that there was a speech, a speech pathologist, a speech language pathologist would treat cognitive symptoms like that.
Yeah, well, I'm glad you're pointing that out because I mean you're not alone. That's very, very common. I feel like oftentimes the beginning of every evaluation and sometimes several sessions afterwards is being able to make sure the individual understands my role because again, because our title is a little bit of a misnomer, but also because it can be a little bit ambiguous. Cognition can be ambiguous and difficult to pin down, and it's very qualitative in nature. Like, right, it's hard to quantify someone's cognitive skills, and even cognitive progress. So I think that, there's that component. I will say one other thing. Tanya, I certainly appreciate, your ability to share your story here on the podcast, because I think one other thing that sort of stops people from pursuing anything is that it can be uncomfortable to say, I'm having trouble doing something that I couldn't do before, or that I could do before. And especially when it comes to cognition, I think that it can be a little bit of a taboo topic. And so I, Tanya, again, appreciate that you will share your story, because I know for a fact that, you're not the only one experiencing it.
So what does the typical assessment include? Does the person get referred to you and come to you for voice, and then they end up finding out they also have cognitive issues, speech issues? They get the full spectrum?
That's a good question. Yeah, so depending on, but yes, it starts with a referral, and the physician refers the individual, and then, yeah, we do, a full review of the medical history, kind of prying a little bit. You'll be asked lots of questions about all sorts of things. And when I assess someone with cognition, I always ask them, why do you think I'm here? Because if they feel that the voice is the thing that's most debilitating for them, then I'm going to try to spend the most of our time assessing that and seeing if I'm in agreement with it. And what I mean, I guess, by an agreement is if I think that is in fact the largest hurdle for them. But I will be looking at the other areas because, I wouldn't want to come in and be spending their time, my time, together and not be addressing everything that needs to be looked at. So there would be a cognitive assessment of some kind, unless that's clearly ruled out very quickly. A speech portion usually involves, looking at the articulation, exam of the facial muscles, the mouth muscles, throat muscles, reading a little bit, conversation. I always take measurement of the frequency, so like the pitch of someone's voice, and also the volume, the intensity of someone's voice, because that is a common change that people have. And then, if it's a reported or documented problem, I usually do have them eat or drink something for me, even if they don't feel like they're having swallowing problems, just so I can fully look at it. So it's a pretty thorough assessment. And yes, you might come for one thing and walk out with 4 things, but but hopefully that's because we're doing, our job well, and we're trying to identify those things so that they're not overlooked.
You mentioned it starts with a referral. So, one question I think our listeners would have is how do you get a referral to a speech language pathologist?
Yeah, so so any physician can make that referral. If you're with your primary care physician, even, you could do that. I think it's always good to make sure your movement disorder specialist is in the know. So if you're seeing them, you just describe the symptoms, and you can ask them, look, I understand that there's treatment for this with speech language pathology. Would you be willing to write me a referral order for it? Oftentimes, movement disorder specialists have relationships with outpatient, clinics that do rehab therapy in your community. So, you might ask them, look, do you have anyone you recommend? And oftentimes they'll have, a list of several clinics that you can consider and look through to see, what would be a best fit for you, that type of thing. And after that, usually, just like you would do in any other case, you would make that call and set up the evaluation. So once you have that doctor's prescription, you can, that's gold. You can show up just about any clinic and receive a schedule, an assessment.
And in terms of selecting a speech language pathologist or a rehabilitation clinic that has one, do you think it's important to seek out one that has experience with working with people with Parkinson's?
I'll give a couple of answers to that. First, I would like to note that, all speech language pathologists that are in the medical setting, any type of medical setting, are trained and qualified to work in all of the areas that I've mentioned: the cognition, voice, speech, language, swallowing. We're all trained in that. And you can probably be pretty confident that you will not be the first person that they've seen with Parkinson's. If they've been in for more than a year, most likely that will be the case. So you can be confident, yes, they're trained, they're qualified. But I would say, if you would like to work with someone who has additional experience in it specifically, again, you should chat with either your physician and ask. So like, for instance, I work with a home healthcare company currently. That's one of the jobs that I have here in the DC area, and we have a variety of therapists, physical, occupational, and speech, who are trained specifically in additional certifications for Parkinson's. And so the neurologists in this area know that. So if you were to ask, hey, is there a group specifically you think I should work with that has experience, they would probably have that information. If not, you should ask when you call it to set up the appointment, the assessment. Hey, is there anybody who has experience with Parkinson's? We'd like to work with them. I think that's a perfectly appropriate question to ask, because there are Parkinson's specific approaches and treatment plans.
That's helpful to know.
Mm-hmm.
I was curious if there are research studies are supporting specific therapies for people with Parkinson's. Yes,
absolutely. So I'll kind of state sort of an overall, research definitely shows, and if you spend any amount of time, following kind of the Parkinson's trends on social media or just on the internet and the news in general, it's really clear that, Parkinson's, although there's not a specific, do 10 kicks and 12 marches and, this type of prescription, there is, because people, want that, you want to know the exact plan. But research is showing consistently that physical movement is important. And it's a big component of, keeping your body healthy, but also specifically for Parkinson's. So that's kind of the overarching yes. please stay active and moving your body. Specifically in my field of speech language pathology, I'm actually really excited to say that there's been some excellent improvement in accessing research for clinicians. So there's more avenues in which we're able to access research kind of on the go. And so there's a few things that have come to my attention in the last few years that I've tried to take advantage of. First of all, I'll say in swallowing, there's some excellent research that is actually not particularly new, but continues to be consistent with the treatment. And that is really looking at the tie of swallowing problems and where they originate from. A lot of times, we're really looking to see, okay, how are the other systems of the body impacted? And in Parkinson's, we actually know that there are often GI, gastrointestinal tract issues.
Mm-hmm.
And so that we've found, the research has found, and we're getting more access to learning as speech language pathologists, how the esophagus, so your throat carrying everything down, and the GI tract is very interconnected to your actual swallow, even the moment, from the moment that food or liquid hits your lips. So being able to have access to that type of research to say, okay, now I know this research is showing me that if this person has Parkinson's, these are the things that I need to be considering and the types of things I need to be providing in treatment to address their swallowing needs. But more specifically, I would say that voice therapy, there are really two programs I'll mention. They're both certifications, additional certifications that a speech language pathologist can receive. Both of them are research backed. And the first one is the Lee Silverman voice treatment, so LSVT, LOUD. The LOUD program through LSVT is for speech language pathologists, and the research showed with a very specific protocol that they've created, when it's implemented as it's designed, the improvement in voice, but also some supplementary areas, including just speech and articulation and even cognition, alertness, this type of thing, has been significantly improved in Parkinson's. Their main emphasis is on being loud. And you might have guessed that from the name.
Yeah.
Right.
And that sounds very simple, and it is simple, but the protocol that you have to be trained in to provide that service is very rigid and specific, because that's what the research shows works. The other program that is research-based is called Speak Out, and that's by Parkinson's Voice Project. And it is also evidence-based, and it's a little bit different from LSVT Loud, because they actually don't just focus on loudness. They focus on speech, voice, and some cognitive tasks as well. So their protocol is different. And they're also known for the loud crowd. That's sort of I don't know if you guys have heard of that, but the loud crowd is part of Speak Out, groups of people that get together and actually compete in their, singing and this type of thing. So those are all Parkinson's-based programs that have research behind them. Quite a few papers proving that these are the programs that work specifically for people with Parkinson's. So that's just naming a few, and I talked a lot, so I'll wrap that one up. But
Well, the two you mentioned, the LSVT Loud and then the Parkinson's Voice Project, are those both community-based? How does someone get involved with one of those?
Oh yeah, that's a good question. So LSVT Loud, if you're, a patient or, somebody who has a person with Parkinson's looking for an LSVT Loud certified clinician, you can go to their website, and their website is lsvtglobal.com, and they have a clinician finder. So you put in your location, and you can see who in your area is certified.
Okay.
And the Parkinson Voice Project, their website also has something similar. I'm trying to remember exactly. You should be able to find a provider. So I believe they have a patient section as well. And you can find a Speak Out provider. And so you can see where they're doing that in their area and that in your area. And I believe they also have some YOPD, some young onset Parkinson's resources, support groups and things like that.
That's good to know.
Mm-hmm. And I'm pretty sure Parkinson Voice Project is based out of Texas, but they have groups all over nationally. So yeah, there's a lot there. And if there's any, oh, go ahead.
No, I was going to say, I think you are right. They're based out of Texas, because I can recall running into them a couple years ago at a conference we attended. I think it might have been a conference down in Tampa, wasn't it, Tanya?
Partners in Parkinson's.
Yeah, Partners in Parkinson's down in Tampa. I can recall seeing their booth there and learning a little bit about what they do. And I think I've seen their booth since then, but at the time I didn't know anything about it. So, and I think you're right, they're based out of Texas.
Yeah.
Well, those are both great resources for people to turn to start to learn a little bit more about, obviously the speech therapy. One of the questions we hadn't asked that I wanted to understand a little better is what kind of voice changes do occur in people living with Parkinson's?
Yeah, so really there's two camps, but both can occur. One would be vocal quality. So people who report that their voice is maybe raspy or harsh, or maybe it's breathy. Sometimes people will, it'll just feel like it's a weaker voice, but it's usually this change in the quality that they'll describe. And then the other camp is volume, and that's probably the better known change, that vocal volume changes. And oftentimes, kind of depending on where you are in your process of having the disease, sometimes it's difficult for you yourself to know that the volume is changing. And a lot of times it will be your family members or people around you who say, can you repeat yourself? I'm not hearing you. Can you speak louder? And the person themselves may feel like they're nearly yelling, but they may be speaking in a pretty, quiet voice where if there's background noise, you're just not able to hear them. So that, and I will say that is often due to, so in the voice box, you have your vocal cords, and in Parkinson's, this is not always what causes it, but oftentimes the vocal cords can bow. So they're supposed to be kind of lined up right next to each other in a little bit of like a V. And when you speak, they vibrate against each other. But if they're bowed, when you're speaking, they can't quite touch at midline. And so it makes it hard for your voice to have the volume that you need, again, to communicate, especially in social settings, or around the dining room table, because there's just other noises that are competing, which can be isolating. So quality and volume are really the two areas that we address.
Well, Hannah, it's official. I'm referring myself to a speech pathologist.
Or seeking an appropriate referral.
Or seeking an appropriate referral would be best. Because as you're speaking on this issue, Chad's looking at me and it's like, that's you. And then when you said sometimes people will feel as if they're yelling, I feel like I'm yelling all the time.
Yeah.
Yeah, I don't think Tanya as much falls into the camp of the volume issue. I think it's the weakness and the occasional raspiness. Mm-hmm. I have to tell you, we're both learning a ton through this, as you can tell.
Good.
I feel like this has been a quasi-assessment.
I'm not taking any report.
One of the things I'd like to talk about before we wrap up is your blog. And
sure.
We talked a little bit about that before we went on the air, but could you share with our listeners what led you to create the blog and what you envisioned for the future?
Yes. I'll start with what led me to pursue that. So about 6 years ago, I transitioned to working at a skilled nursing facility in Virginia, and I had a patient that was referred to me who lived there, at the facility, and a gentleman, and he came in, and he was my first patient with Parkinson's, and I assessed him, and we began to work on a couple of things that were troublesome to him. And because he was somebody I was seeing on my caseload. I was taking some time to learn a little bit more about what I could do for him. And in that time, we not only made progress, but he and I just got along really well. We really enjoyed each other. We had a good relationship. And then over the ensuing 3 to 4 years that I worked there, his symptoms changed. The disease progressed, and he was experiencing different things or new things. And he would come back, and I would reassess him. And over that period of time, he, well, our patient therapist relationship really grew into more of a friendship. And when we were there in that professional space, he just completely was an open book to me in a way that allowed me to learn. Gave me a lot of appreciation for him, letting me sort of pick apart his symptoms. And he would tell me a symptom. If I didn't know enough about it, I grabbed the research and come back, and we would work these things out together. And to have, you may not have that type of connection with every person, but he and I worked together for years like that. And it really helped me develop an interest in Parkinson's specifically, because I've always had an interest in neuroscience and just the brain, but it really helped me learn a lot more about it. And I think that it gave me a glimpse into that as a clinician, I have a choice to bring my best to the table or to sort of just fly by the seat of my pants. And when I took the time to really invest in what I was working with, it made a big difference for me, and it made a big difference for him. And I just decided through him and our friendship that really at this point, 6 years down the road, I still pay him, social visits. It's more like family. And when you have a personal connection like that to a disease like Parkinson's, it's very motivating. And it, although he's not my blood family, he's somebody who, I want to see him do well. And because of that, I really just decided to dive into the community. And I really wanted to explore what kind of asset I could be to the community. And so the longer I worked with him, the more I felt confident in doing that. And really, I just took it from there. So that was what led me to pursue providing something online. I will say, when I think about my website, the Parkinson'S report, I want it to have two pieces. Right now, there's really one part that is up and running, and that's the blog. So every other week, I write about a Parkinson's topic, and you can find that at theparkinsonsreport.com. I have 3 groups of people that I'm really targeting. The first is, people who are living with Parkinson's. The second are, their care partners, families, loved ones. And then the third are rehab therapists like myself. And that's a pretty wide audience, but I believe that those are, the 3 groups of people who I interact with most in my day-to-day of treatment, and the people who need the information. So the blog addresses that from a variety of angles. It's pretty topical, but it is something I think that's helpful to just sort of keep things moving and keep resources available for people. The other component that I was telling Tanya the other day, I'm really working to create our resources and tools where you can go and say, okay, I want more information on, symptoms I might be experiencing. And then there you have maybe, a handful of resources available where you can just sort of, click and go. I don't feel the need to reinvent the wheel because so many people have provided excellent resources, and I just need to compile them in a space that's conducive to accessing it more easily. The other thing, is, if you're having trouble with something like swallowing, being able to say, hey, here are my, top 10 resources for this particular area. And I've gradually also been working with some physical and occupational therapists to try to get their voice on the website as well. But as projects go, it's certainly in the growth and development stage. It's going to take a little bit of time, but I certainly hope that people begin to use it as a resource as I continue to build it. My hope is that it's a helpful avenue for people to easily navigate the information they're looking for, whether they're just recently diagnosed or maybe further along in their journey. Maybe caregivers, who are looking for, some tips on how to manage, certain things that have changed. So anyhow, kind of a long-winded answer, but have lots of hopes and dreams. We're just taking it a day at a time and moving forward with it. But please feel free to go check it out and, send me a message if you have specific topics you hope I cover.
You should not cut yourself short. Although you're kind of new on the scene with respect to the blog, I think it's a great resource for people, so they need to go check it out for sure.
Yes, thank you.
And I'll say a couple of things on that. One, on behalf of two members of the Parkinson's community sitting here, I can say I'm very glad and grateful that you decided to dive into this community and become an asset, because you clearly are, and including right in this very moment where you are educating us and many others about aspects of the non-motor symptoms of Parkinson's that are so hard to understand and that we're often not aware of.
Right.
And the other thing I'd say about the website is I think you're absolutely right that there's a lot of information out there, but there's a need for resources that help connect you with those other, like you said, not reinvent the wheel, but say, if you're experiencing this symptom, here's, like you said, my top 10 resources that you can use. And they're pulled from different areas. And so instead of somebody having to run Google searches and hunt around, they can go and they're all gathered together there. That's one of the things we're trying to do with this podcast is as we build it over time, build the different topics we cover. Our hope is people would, come to the podcast if they come to it a year from now or, 18 months from now, and they say, wow, they've got episodes on all these different things with a lot of focus on the non-motor symptoms and can get an education that way and discover lots of useful resources and just information they otherwise wouldn't have reached or would have been hard to find.
Absolutely.
Well, with that thought, I think we could wrap up. We greatly appreciate you joining us on the podcast, and we'll have to figure out a topic to talk about in the future, because I'm sure we'll come up with something else. And we look forward to watching the Parkinson's report as it grows and evolves over the next year or so.
Yes, thank you, to both of you for having me on. I'm just excited to be part of the conversation, in the Parkinson's world. So thanks so much for having me, and I look forward to it if we get to chat again.
Thank you for educating me, Hannah.
No problem. Anytime, Tanya.
Can I call you for speech therapy?
Yes, absolutely. Sure. Give me a ring anytime.
Thanks, Hannah.
No problem. You guys have a good one.
Thanks for tuning in for this episode of PD Connect. Please help us connect with the Parkinson's community by spreading the word about this podcast. You can find us online at pdconnect.org and on Facebook at PD Connect Podcast. You can also follow us on Twitter at PD_Connect. Again, that's PD_Connect. Until next time, this is Chad and Tanya signing off.